Hey guys, it is Ryan. I'm not sure if you know this about me, but I'm a bit of a fun fanatic when I can. I like to work, but I like fun too. It's a thing. And now the truth is out there. I can tell you about my favorite place to have fun. Chumba Casino. They have hundreds of social casino style games to choose from with new games released each week. You can play for free anytime, anywhere. And each day brings a new chance to collect daily bonuses. So join me in the fun. Sign up now at ChumbaCasino.com.
No purchase necessary. VGW. Void where prohibited by law. See terms and conditions. 18+.
Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, Eric Christensen. Thanks so much for listening, and definitely if you enjoy the podcast today, go to reallifepharmacology.com and snag your free 31-page PDF on the top 200 drugs. Really unique little resource. I've had, pharmacy technician educators reach out to me, nursing folks, pharmacy folks. Good little resource on really important, testable, and real-life clinical pearls on the top 200 drugs. So absolutely free for following the podcast. We send out emails when we've got a new podcast available and or any new products and things going on. So again, go check that out, reallifepharmacology.com. The drug of the day today is Tizanidine. Brand name of this medication is Zanaflex. And I will say I see it used periodically anyway, in geriatrics specifically. Most often, the indication that it's going to be used for is muscle spasms. And this drug is classified as an alpha-2 adrenergic agonist. And the way I kind of remember some of the effects and things of that nature is Tizanidine and clonidine do have some similarities mechanistically. Ultimately, as far as its anti-spasmodic type activity, it can cause neuronal presynaptic inhibition is basically how it ends up working. And it helps me because I see clonidine a little bit more. I think clonidine's a little bit more well-known or well-taught, maybe drug. And understanding that it's going to have some similar mechanism, you're going to have some similar type adverse effects. So side effect profile, I think about blood pressure lowering effect. But in addition to that, there's also warnings on if patients are taking Tizanidine consistently and they abruptly stop taking the medication, there is a risk for rebound hypertension. And that can happen with clonidine as well. So it is important, I think, to remember that. Along with the lower blood pressure, bradycardia can happen as well. A lot of kind of older skeletal muscle relaxant medications from that class can cause dry mouth, so that can happen with Tizanidine. And of course, a lot of the generic CNS depressant type adverse effects. Fall risk, dizziness, sedation, things of that nature can certainly all happen and are probably much more likely in our geriatric patient population. There have been rare issues associated with liver disease and liver dysfunction, so I think it's important to note that as well, particularly in patients maybe at risk for that complication. Moving on, talking about pharmacokinetics, one of the major pathway that Tizanidine is broken down is by CYP1A2. So if we've got pharmacogenomic alterations in that enzyme, for instance, a poorly functioning or a slow metabolizer through that enzyme, we probably will run into the likelihood of increased concentrations. And of course, I'll talk about drug interactions in a little bit as well in medications that inhibit the CYP1A2 system. One other thing from a pharmacokinetic standpoint I did want to mention, there is some caution with renal impairment. particularly accumulation of the drug as we get to lower stages of CKD. So, I think of generally less than 25 to 30 mils and lower, mils per minute and lower. You're probably more likely to run into situations where patients can't tolerate higher doses, and or if we start too aggressively, we could overwhelm them a little bit with too much medication. So it is important to make sure that renal function is okay, or at least be very cautious if it isn't as good as we would like it to be. All right, so let's take a quick break and we will follow up with drug interactions. If you're in the market for pharmacist board certification study materials like NAPLEX, BCPS, BCACP, medication therapy management, or the geriatric exam, definitely go check out meded101.com/store. In addition, if you're a healthcare professional who works with medications, we've got great books on clinical pearls, case studies, things that actually happen in real life. So go check out all those resources, meded101.com/store. All right, so finishing up on drug interactions, one of the first interactions that I have definitely come across is ciprofloxacin. So ciprofloxacin inhibits CYP1A2. Now, if you remember from the kinetics section when I talked, CYP1A2 is an important enzyme that breaks down tizanidine. So by blocking CYP1A2, we're going to run the risk of tizanidine toxicity, sedation and confusion and dizziness, hypotension, and all that stuff. So very important to remember ciprofloxacin, I think, when it comes to tizanidine use. So in that situation, what would we do? We would likely at least look at the dose of tizanidine, reduce the dose, see how much the patient is taking, and kind of go from there as far as what we're going to do as far as a judgment call. There could be a possibility, maybe a urinary tract infection where, other medications may be available, maybe a macrodentin, for example, or a Bactrim. So we could have other alternatives to Cipro if for some reason it's really felt that, tizanidine needs to continue at the current dose that it's at. So again, very, very important to monitor, look out for that. Possibly doing dose reductions and or changing agents depending upon what's available and what's clinically appropriate there. Food-drug interaction. So this drug does have a little bit of issues, alterations, I guess I should say, with food. And I want to remind you of the MedEd 101 Guide to Drug-Food Interactions. Recently put this book out. I think it fills a nice void as far as covering a lot of really, really important drug-food interactions. All the drugs are listed by drug name alphabetically and generic, so it's really meant as kind of a reference guide type of thing. But anyway, the tizanidine interaction with food is food can actually increase the extent of absorption. And it's a little bit more pronounced, at least in the literature. It's more pronounced with the tablet formulation of tizanidine, which is what I've seen used most often in clinical practice compared to the capsule formulation. So what we look out for there is obviously enhanced effects from tizanidine, whether that be more skeletal muscle relaxation, and or side effects could result from that as well. So good one to remember there as far as the effect of food and tizanidine. In addition to the CYP1A2 and the food interaction, I look at the adverse effect profile. So blood pressure lowering agents. Remember I mentioned bradycardia, so beta blockers, those type of agents that can lower pulse may have that additive effect onto tizanidine. So important to definitely remember that. Of course, our sedative type agents, alcohol, opioids, benzodiazepines, any sedative type agent could obviously have additive effects on top of tizanidine there. And one last one, I mentioned dry mouth is somewhat common with tizanidine. Certainly a patient getting anticholinergics with tizanidine that would worsen that dry mouth, as well as potentially risk for CNS adverse effects too, such as dizziness and fall risk and things of that nature too. So definitely a few important interactions, I think, with tizanidine. Definitely laid out a few that I think are common or somewhat common in clinical practice. And I think that's going to wrap up the episode for today. So if you enjoyed the podcast, if you find it helpful, definitely leave us a rating, review on iTunes. Share us with students that you have on rotation or classmates, anyone that may benefit from becoming better at pharmacology and obviously picking up some of these practice pearls that sometimes often go overlooked or missed. So I thank you so much for all the kind words of support. Greatly appreciated. You can track me down at LinkedIn, Eric Christensen, PharmD, BCPS, BCGP. Don't hesitate to shoot me a message if you've got a suggestion or a comment or anything. And, of course, support the sponsor, meded101.com/store with all the links we have there. I'm going to sign off for today. Thank you so much for listening, and I hope you have a great rest of your day.
Judy was boring.
Hello.
Then Judy discovered ChumbaCasino.com.
It's my little escape.
Now Judy's the life of the party.
Oh, baby, mama's bringing home the bacon.
Whoa, take it easy, Judy. The Chumba life is for everybody. So go to ChumbaCasino.com and play over 100 casino-style games. Join today and play for free for your chance to redeem some serious prizes. ChumbaCasino.com.
No purchase necessary. Void where prohibited by law. 18+ terms and conditions apply. See website for details.